Hey everybody, this is Summer Terry, and today we are here at Pine Ridge Equine Hospital in Glenpool, Oklahoma. And Dr. Metcalf just got finished doing a kissing spine surgery on a horse for a client of ours. And we thought this was a great opportunity to learn a little bit about the ligament snip surgery, which is the less invasive of the two, and kind of compare your success rate with the lig snip compared to the bone shave, and learn all about it.
Yeah, you bet. So on this horse, because the overriding processes or kissing spine wasn't too severe, the picking this surgery over the one where we removed the bone seemed to be a good fit for this horse. That's how I tend to pick which one I'm going to use. I'll do both, but if there's enough space and we can cut that ligament, then we can give the horse a lot of relief and have very good success without having to do the more invasive technique of removing the bone.
Okay, so let's back up a little bit. I know, like, for our social media followers, we've covered the topic of kissing spine quite a bit lately. But for those that are just kind of tuning in, so what exactly is kissing spine?
So kissing spine has been known for a while. Back in the 80s, that's kind of when the term kind of came around, like overriding dorsal spinous processes. So we didn't know exactly if it caused a lot of problems for some horses, but now it's becoming more and more known that some horses do suffer from quite a bit of pain and limitation in their work and what they can do and what they can perform. So when those dorsal spinous processes, which is mostly in a thoracic vertebrae, begin to touch or even override, where they are passing each other and interfering with each other, it causes quite a bit of pain. And in between each one of those is a ligament called the interspinous ligament, and that has been the one where we cut the ligament. So cutting that interspinous ligament relieves that and also gets those dorsal spinous processes to move away from each other.
Okay. So what kind of things do you see, like, symptom wise? I know your horse bucking was your chief complaint, but when we're talking about poor performance, what are some of the things that you see that bring horses in for back pain?
Well, that's the thing about back pain. It's so variable from horse to horse. It could be something as simple refusing to enter arena, say if it's a barrel horse, or it could be severe back pain that just never goes away, is not relieved by traditional methods like injecting them, shockwave, PMF, all the different techniques that we can relieve some of this pain from them. So now the ones that certainly that do present the worst are the ones that do buck you or kind of turn you into a lawn dart pretty fast. So those are the worst case. But some of them can be very mild at first, and it's difficult to kind of tease out, is that primarily the problem, or is it something else that's bothering the horse?
Okay.
So during the shave, isn't like the ligament cut, like, or is it like still together? So like during your shave, like, is the ligament cut? So are you getting like both, like the ligament snip and the shave at the same time?
Yes, to get that bone out there, you have to cut the ligament to some degree. Now, depends on how much bone you remove. Now, it may be surgeon dependent how much they cut, how much bone they remove, but yes, in a way, you are removing part of that interspinous ligament anyways as you're removing the bone. There's no way around it.
So how would you determine, because you do both surgeries, correct?
Mm-hmm.
How do you determine which one is appropriate for the horse?
Well, based on clinical symptoms and radiographs mostly. If there's enough room and their bone is not severely proliferative, I will leave the bone alone and just cut the interspinous ligament. Now, if they're overriding real bad, or there's a lot of bone proliferation, you almost have no choice. You have to take the bone out.
And so, whenever you see, like, on the X-rays, where you have the building up, and is that remodeling of bone? Is that arthritis? When you actually see the top of the spinous process touch, what causes that? Like, what are we actually looking at?
That's mostly bone remodeling from that interference of them hitting each other, chronic irritation, inflammation in the bone that leads to that remodeling. And bone can only do two things. It can only make more or remove some, and it almost does both at the same time. Some of them become lytic, but also proliferative at the same time.
Okay. So kind of step us through the process. Like obviously this horse came, by way of referral from the vet that was seeing the horse previously. But, for somebody that's not familiar with the procedure, kind of step them through the process all the way up to surgery and what goes on during the surgery.
Yeah, so first, the diagnosis is the hardest part, really. Truly identifying back pain as the primary problem is the hardest, really. We have to use all of our diagnostic skills. What is the horse doing? Listen to the history. What has been done before? Because there may be multiple vets involved that already seen this horse, treated things. And one way to diagnose it is trying to use our diagnostic analgesia. Just like doing a nerve block on a horse that's lame in the foot. Try to sometimes localize it that way. Radiographs are certainly the key to identifying it, and then some even go to bone scanning and more advanced imaging. But unfortunately, if it was you or I, we'd be putting an MRI or CT, but we can't do that with a horse, so we have to rely on basically plain radiographs, ultrasound sometimes, and then occasionally bone scanning and diagnostic blocks. And putting all that together, trying to figure out, is this truly the back or is there something else? And sometimes, unfortunately, you go through this long process of we've tried all these other things and nothing's working.
Right.
The back's still a problem, and then we end up going to surgery. So, that is almost the most difficult part, is diagnosing it. And then once you get past that, really, the surgeries and the rehab is the next step. So the surgery, whether you need to do the interspinous ligament desmotomy or do the bone resection or cranial wedge resection of the bone, that is mostly surgeon dependent. Also, what the radiographs look like and what the horse is doing.
And so, are these horses, do you put them out completely to do the surgery, or let's talk about the anesthesia aspect of it?
So I tend to do all of mine standing. It's easier on the horse. It does end up saving the client money too from not having to anesthetize them. A lot of them do tolerate it really well with just sedation and local anesthetic down their back. And I could do both procedures standing, so I don't necessarily have to knock them out. Now, if you had a really bad horse or something that may be case dependent, but most all of mine I just do standing.
Oh, and I feel like that has less risk than having to have them get up and down, and I feel like it has to have its benefits as well.
Yes, it does. Yeah, it is nice because the horse doesn't have to wake up, and there's much less risk of that recovery process.
Right. And so, do they go home the same day? Do they stay a day or two?
Yeah, so if it's the interspinous ligament desmotomy, where we just cut the ligament, they go home the same day. It's just really an outpatient procedure. If we need to do the cranial wedge resection of bone, then because of the incision length and the complications with incisions, they tend to stay longer, at least 1 or 2 days.
Okay. So it takes a little bit, because it's a little more invasive, I would imagine.
Yes, it is. Yeah.
So what advice would you have, or what's something that you would tell an owner that is apprehensive or is fearful of having the procedure done, or maybe somebody that's not had to do a surgery on a horse before?
Well, if you were concerned about the procedure, really it's not, it sounds aggressive or maybe highly invasive, but really it's not. It's pretty, especially the interspinous ligament desmotomy technique, it's pretty minimally invasive. It's pretty quick procedure. There's low risk to the horse, and overall there's a pretty high success rate with either surgery. According to the research, both have very good outcomes. Both have very good chance of horse returning to work or even higher level of work because they're hindered by their back pain. But overall the success rate is really good. There's pretty little complications. Most any kind of surgery, there's always risk of infection, risk of complications related to that, but other than that, really it's a very low risk surgery compared to other surgeries that we do.
Mm-hmm. What research is out there I mean, are there a lot of papers that have been written, or is this a new procedure, or is this something that's been done for a while?
Yeah, since about 2012 or 2013, the paper that was published about doing this interspinous ligament technique as a treatment for these back pain or kissing spine horses, that's when it was published. Now, they were probably doing surgery on those horses before that, but before it got published, it was around that time. And the surgery has evolved, especially with the cranial wedge resection. You used to go in and take a lot of bone out. Now we found out you don't need to take that much bone out. Just need to give them space, and it makes their back look much more cosmetic and keeps them from having more complications. So it's certainly evolving. There's actually new research and some studies about looking at the ligament itself. Is it the problem? Doing histopathology, and then we're getting enough cases now where we can do retrospective studies and show these horses did improvement in their performance. And versus just kind of describing how the surgery, how to do the surgery and stuff like that.
Right, that makes sense. Well, and one of the things that I pointed out that I noticed, from a bodywork perspective is, the fact that you're not really disturbing the fascia. When we're talking about our fascia and our sheet that lays over the top of the ligament, I saw like how you go in underneath the ligament. You're not disturbing that, and I feel like with your bone shave, whenever you have to get more invasive, that's one of the things, like as far as in our rehab, that takes the most time to heal is getting that fascia to glide and getting it where there's no restriction, and that ligament can move like you want it to because it's not being adhered down to sticky fascia. And so I enjoyed the fact that being able to actually watch and see that process of avoiding that whole area.
Yes, it does. It's certainly much less invasive doing it that way because I don't have to disrupt that dorsal spinous ligament that runs all the way down their back to each one of those. When we do the cranial wedge, we have to split that, remove it from the top, and then take the bone out. So it is less disruptive, especially the soft tissue. But it certainly does, both of them work really well, and it just, again, it's just case dependent what you have to pick. Sometimes you have no choice, you have to take the bone out. But.
Right. Is there any follow-up care? A lot of these horses come to us in the rehab, and, with doing the lig snip surgery, mostly what we're doing then is fitness and engaging that core, getting the hind end built back up, basically rebuilding all of that muscle that's lost or was, creating compensation patterns. But, as far as like injecting the back, as far as, is there any, risk of developing arthritis or having to maintain with injections?
Sometimes. It depends on the case, depends on how they respond. I don't really go in wanting to do anything additional unless the horse needs it.
Okay.
So I usually rely on the rehab, the stretching, building up their core, doing all the fundamental stuff, get the horse fit first. They're still struggling to have back pain or muscle soreness. Then we go in and do something additional like, injecting their back, potentially like OSFOS or shockwave therapy, things like that, if that's necessary. But most of the time it's not necessary once you do the surgery. So definitely the beginning part of rehabbing them is getting the horse fit, getting their muscle tone back. That way they can support their back properly when the rider's on them.
Correct, yeah.
So going into the rehab, like when can they start work? Like after the lig snip and after the bone shave?
Well, it depends on the case too, but on average, they're back to work in 6 weeks with interspinous ligament desmotomy surgery. I want them to go back pretty quick and start stretching them immediately. Start really working on getting their back to stretch out and get those vertebrae moving again. And so they're usually back to work in 6 weeks after that surgery. Now, after cranial wedge resection of bone, that's going to be about 2 to 3 months on average.
And so is that like going back to riding or just going back to like under saddle work?
Usually back to under saddle work, slowly bringing them back, but with the interspinous ligament, I don't restrict them. After 6 weeks, they can go back to basically full work.
Okay. Yeah. Is there, we talked a little bit about the follow-up. Gosh, I feel like we've covered quite a bit here. But how common of a problem is kissing spine? I mean, I know probably it's been something that's not quite been diagnosed for a long time because, in humans, back pain and back issue, that's one of the chief complaints that we see in people. So, we would understand that our horses are under a lot of demand with their spines as well.
Yeah.
But how many of these surgeries do you do on average?
Well, I don't do a lot of them. Most of our cases are referrals, the prevalence of back or kissing spine is probably pretty high. If we went around and radiographed a bunch of horses, we'd probably see a lot of it. But the problem is, those sometimes images don't correlate with pain. The old saying, horses don't run on radiographs. They don't always present with back pain or performance issues, even though they radiographically have a lesion. So that's where it gets difficult to sort out, are the ones that do need surgery or that do truly have kissing spine that need treatment versus the ones that just have radiographic abnormalities. So those are kind of difficult to diagnose, and there's really not a lot of research, unfortunately, in the prevalence of kissing spine. We need probably more data in more cases, and we're probably getting them. We just need to publish that information.
So if somebody was doing a pre-purchase on a horse, would you suggest doing spine x-rays as, just as you would your hock or your stifle or any of the other stuff that's, typically in our pre-purchase?
Yeah, that gets sticky sometimes. It is good. It is good to look, but I think it's basically telling the client, what's the risk? Every time we do a pre-purchase, we're trying to judge risk. How much risk are we at to buy this horse, and is there going to be problems down the road? So yes, it's good to x-ray their back, I think, but if you find something, will it kill a sale all the time? Not necessarily. It is hard because you get a snapshot in time. When you do a pre-purchase, you got one look at this horse to figure out, is it safe to buy? And if the horse is not having performance issues or doesn't have back pain, then I'd tell folks I think it's still safe to purchase. But there is there is a potential problem there that could develop. So it is tough to kind of decide, is it, do we basically kill a sale of a horse just because there is a lesion in their back?
And at least at that point they know, and they're going to know how important fitness is because, we feel like that goes back to a lot of having your core strength, having your glutes strong, not overworking your hamstrings, having your hoof angles correct. So, at least if that horse might have a slight issue there, you're going to know how important fitness is, I feel like.
Yeah, and there's some data out there too that there is pretty high success rate with medical management of these backs too. So if you had one that's early on, you may be able to avoid surgery by properly doing all those things. Get them properly fit, riding them differently, working them differently, and protecting their back in a way, and then avoid from things getting worse or needing to go to surgery to fix it. So that's an option too.
Absolutely. Any other questions?
I think you answered all of my questions.
I was going to say, I think that you covered a lot of great information here, and I appreciate you sitting down with us.
Absolutely. My pleasure.
Thank you.
Yeah.